नमस्कार एन्ड वेलकम टु सिक्किम क्रोनिकल। सो प्रत्येक वर्ष 10 सेप्टेम्बरलाई वर्ल्ड सुसाइड प्रिभेन्सन डे भनेर विश्वभरि नै अब्जर्भ गर्ने गरिन्छ। यो आजको कन्टेक्स्ट हाम्रो लागि किन इम्पोर्टेन्ट छ भन्दाखेरि हामीलाई थाहा भएको कुरो हो कि सिक्किममा सुसाइडको रेट जुन छ यो 43.1% छ पर ल्याक पपुलेसन, जो नेसनल एभरेज 12.4% भन्दा धेरै नै बेसी छ। र स्टेट गभर्मेन्टको एउटा इनिसिएटिभ छ सिक्किम इन्स्पायर्स, जस अन्तर्गत विशेषतः जति पनि स्टेक होल्डर्सहरूलाई लिएर अनि गभर्मेन्ट अफिसर्सहरूलाई इन्भल्भ गरेर एउटा स्ट्राटेजी बनिँदैछ बटम अप्रोचलाई लिएर, र यसको निम्ति धेरै मन्थन भइरहेको छ, धेरै कन्सल्टेसन्सहरू भइरहेको छ स्टेक होल्डर्सहरूसँग। र मसँग अहिले हुनुहुन्छ डाक्टर सोनाम लासोपा, र उहाँ नोडल अफिसर हुनुहुन्छ फ्यामिली एन्ड हेल्थ वेलफेयर डिपार्टमेन्ट सिक्किम इन्स्पायर्सबाट, र हामीसँग हुनुहुन्छ मिस्टर सौमित्र पात्रे, जो डाइरेक्टर हुनुहुन्छ सेन्टर फर मेन्टल हेल्थ Law and Policy, Indian Law Society, Pune. First, let me start with you, Mr. Soumitra. Every year we observe 10th of September as World Suicide Prevention Day. We take out rallies, we discuss, we have consultations. But, for Sikkim it's very concerning because of the rising cases every year. So, what is your approach? I mean, basically, what is your approach towards this?
What's suicide prevention? It's good we celebrate the World Suicide Prevention Day, but actually, suicide prevention is a 365-day affair. We can't be doing suicide prevention one day of the year and forgetting it for the rest of the year. Also, I think we need to understand that suicide prevention is not purely a health sector issue. It is an intersectoral issue. The antecedents of suicides, for example, vary very differently. So issues like unemployment, financial stress, health related problems, mental health, debt, interpersonal violence, the use of alcohol, all of these are related to suicide. So if we wanted to actually address suicides and address attempted suicides and reduce suicides, then we need a multi-sectoral approach to it. Just health sector is not going to be able to solve it. So our emphasis has always been to take a whole of society approach to it rather than to look at it as a pure health sector initiative.
So yesterday you had a consultation with the government employees, government officers, and today you are interacting with the stakeholders, right? So I mean, how has been the response, especially on the second day?
Oh, the response has been brilliant. I mean, I have to really congratulate Sikkim Inspires and Dr. Sonam and her colleagues for, doing this in the way that we advise people to do it, which is to take a very bottom-up approach, engage the entire community in developing a suicide prevention strategy. Because, we need to develop a suicide prevention strategy which is for Sikkim, by Sikkim, designed by people in Sikkim, so that there's a sense of ownership to the policy as well as to the strategy for reducing suicide. So, this is a wonderful way about going about it, and I'm really glad. In that sense, many states in the country have a lot to learn with the approach that Sikkim is taking to addressing this issue, rather than just doing a top-down approach to it.
So we have a national suicide prevention policy already on place. So how much it has been impacted, especially when it comes to the implementation?
Well, there's the National Suicide Prevention Strategy was adopted 2-3 years ago, but unfortunately we have not seen a lot of action out of it. So many reasons. I think one of the first and most important reason is suicide is a very stigmatized issue. In our communities and societies, we don't really talk about suicide, and the only time we talk about suicide is when there is a big media story about it, and even there then we get into the blame game thing. Who is responsible? Who was responsible for this suicide? But we don't really say, okay, we can reduce suicides. One of the challenges I find even with our policy makers, for example, is that people don't believe that we can actually bring suicides down. In their heart of hearts, there is a sense that we don't really believe that we could do things to bring suicides down. And I think that's the thing that needs to change. We need to change the attitude towards it. We need to really start believing that suicides are preventable, that suicides can be reduced. And when we say suicide prevention, we are not talking about bringing suicides to zero, but even reducing suicides. I mean, look, India has close to about 180,000 suicides in a year. Let's say we reduce suicides suicides even by 10%, okay, we're going to save 18,000 lives. Now that's a lot of lives to save. So a suicide prevention strategy which brings about even small reductions in suicide can save lives. Like, let's take the media, your media for example. We know that if the media reports suicides responsibly, for example, we can reduce suicide rates by about 1 or 2%, okay. So now in the Indian context, 1 or 2% can mean 3 to 4,000 lives saved.
You mean to say without sensationalism?
Exactly. So just getting our media to report suicides differently, that doesn't cost money. It doesn't cost the media any extra money. But if we just got them to report it more responsibly, we could bring suicides down by 1 or 2%. 1 or 2% in India is going to save 3,000-4,000 people's lives. So even small little bits that we can do can actually bring down suicides dramatically.
So let me bring in Dr. Sonam Laswapa. They say sooner the better. So the consultation is on progress, and you have been interacting with different stakeholders coming from different spectrum of life. So when can we what is the next step after the consultation?
सो तपाईहरुलाई भन्नु पर्यो भने हाम्रो यो हिजो चाहिँ गभर्नमेन्टको कन्सल्टेसन थियो. आज चाहिँ जसरी सरले पनि भन्नुभयो, आज चाहिँ सिभिल सोसाइटीको एउटा कन्सल्टेसन छ जहाँ चाहिँ हामीले आम नागरिकको आवाजलाई र उहाँको एक्सपिरियन्सहरू सबैलाई समेटेर चाहिँ हामीले आज एउटा कोलेट गर्ने. त्यसपश्चात हामी 12 तारिकको दिन चाहिँ एउटा स्मल ग्रुप कन्सल्टेसन राख्ने जहाँ चाहिँ फेरि गभर्नमेन्टको मेम्बर्स पनि हुने र हाम्रो सिभिल सोसाइटीको मेम्बर्स पनि हुने. उहाँहरू हामीहरू सबै बसेर चाहिँ एउटा ब्रेन स्टर्मिङ एउटा वर्कसप जुन चाहिँ हामीले थ्योरी अफ चेन्ज वर्कसप भन्छ, त्यसमा चाहिँ हामीले चाहिँ अगेन यहाँ कोलाबोरेट गरेको छ हाम्रो सेन्टर फर मेन्टल हेल्थ ल एन्ड पोलिसीबाट आएको हाम्रो आउट अफ स्टेट गेस्टहरूसँग बसेर चाहिँ हामीले मिलेर एउटा लोकलाइज्ड बटम अप अप्रोच एउटा लिएर चाहिँ हामीले एउटा स्ट्र्याटेजी बनाउने ताकि हाम्रो मानिसहरूले र हाम्रो गभर्नमेन्ट स्टेक होल्डर्सको र नेसनल लेभलको एक्सपर्ट्सहरू पनि हुनुहुन्थ्यो हिजोसम्म. अनि हामी सबै मिलेर चाहिँ एउटा स्ट्र्याटेजी बनाएर अब छिटै नै हामी एउटा रिपोर्ट कोलेट गरेर चाहिँ हामीले एउटा रोड म्याप बनाउने ताकि हाम्रो सिक्किमको लागि चाहिँ एउटा आफ्नै लोकल एउटा स्ट्र्याटेजी होस्. किनभने चाहिँ जस्तो नेसनल सुसाइड प्रिभेन्सन पोलिसी छ र स्ट्र्याटेजी छ, तर हाम्रो सिक्किम त अरू स्टेट्सहरू भन्दाखेरि अलिकति अलग जस्तो नै लाग्छ कतिवटा कुराहरूमा, र अरू नर्थ इस्टर्न स्टेट्सहरू भन्दा पनि हाम्रो परिस्थितिहरू अलिकति सिमिलर छैन, हामीहरू अलिक अलग छ. त्यस कारणले चाहिँ हामीलाई पनि आफ्नै एउटा सल्युसन हामीले त्यसमा पुग्न सक्यो भने चाहिँ झन् इफेक्टिभ हुन्छ कि भनेर हाम्रो एकदमै ठुलो आशा छ. र हामी छिटै यो सबैलाई समेटेर र हामी स्ट्र्याटेजीहरू निकालेर त्यसपश्चात हामीहरू त्यो स्ट्र्याटेजीहरूलाई हामी इम्प्लिमेन्ट गर्नेपट्टि चाहिँ हामी एकदमै जटिल भएर चाहिँ हामी जोड लाउनेछ.
Right. So in the end, as a closing comment, is there anything you would like to transpire to the people watching right now, especially when it comes to mental health and suicide?
Well, one of the main things that I think we should let everybody know is that suicides can be prevented and should be prevented, and every one of us has a role to play. You, me, everyone. Small things that we can do can help prevent suicides, So what I would encourage people to do is that whenever you hear somebody who might be at risk of suicide or is talking about suicide, the simple thing you can do is talk to them. If we just talking about it, talking to people who are like that, we could actually start saving lives.
Right. So under State Health Department, your initiative bhairaheko cha to formulate a strategy to combat basically a very very concerning issue which is suicide. र आशा छ कि है तपाईहरुको यो जुन प्रयास छ यसले एकदमै कलरफुल एउटा रिजल्ट ल्याउने छ भनेर हामीले आशा राखेका छौं. And we'll be bringing more information on this consultation workshop with Ashish. This is Nirmal for Sikkim Chronicle.